welcome. We have these every couple months, and then we take over, our next one is going to be November 29th to December 7th. Okay, so right the weekend following after Thanksgiving. Okay. So we have these just to kind of, we have the discounts, we have the free food, the free literature, so please help yourself to any of those things. I'm here only during these wellness weeks, okay? I'm here to answer your questions. And just a little background on myself, I'm a certified lifestyle educator. I've been in the nutritional industry for almost 20 years, okay? I've been with Nutritional Frontiers for almost 4 years. I've known Dr. Weiner for almost going on 8-9 years, okay? And I normally go around to different doctors' offices and healthcare practitioners and show them the latest research and science about these different nutrients and implement nutritional programs in different healthcare practices. But in the 20 years I've been doing this, there aren't too many questions that I have not been able to answer or don't know the answer already. So feel free you can ask me anything about any condition when we're done after the talk, okay? So I'm very excited that everybody's here today. Dr. Weiner wanted me to talk about some natural solutions for pain and inflammation. This is a major issue, and not many people realize that there are very safe, effective nutrients for these types of pain issues. And unfortunately, the medical doctors are not really aware whatsoever of these safe and natural solutions for pain and inflammation as well. So we have a lot of different options. We'll just talk how we break these down, how these are utilized, to show you some of the research behind these on them as well. We've had tremendous success with this. I work with a lot of different chiropractors in the area, and this is one of the biggest problems that they are dealing with is joint pain and arthritic pain aspects. Okay, so if we look at the actual knee itself, again, we can see what's going on here in the knee: eroding cartilage, exposed bone, bone spurs, eroding meniscus, or you can have torn meniscus. These are some of the more common health issues. So we see what it's supposed to look like, normal cartilage, and then you can see actually what's going on with the damaged cartilage issues as well, okay? So a lot of people in the health industry, a lot of orthopedic surgeons, a lot of medical doctors feel that there's nothing natural that you can take to heal this. And I would personally disagree with that. We can regenerate cartilage. We can help with the layer of fluidity between the bones and the joints, is known as synovial fluid. And we have nutrients that will actually replenish this layer of fluidity. And when we age or when we have injuries, the wear and tear, you lose that fluidity, that synovial fluid. So we have nutrients that actually can regenerate that synovial fluid, and we can really help with all of these major issues. And we've had even chiropractors who've had torn meniscus themselves, who've gone to see orthopedic surgeons and said that you need surgery for that. And we've said, no, if you try some of our supplements, such as our HA+, we can actually heal torn meniscus. Now, it didn't happen overnight. It was about 3 months, but he actually canceled his surgery. So that's pretty amazing to actually heal torn meniscus. And again, we'll just talk about some of the reasons why that occurs. But a very common saying that you hear in the medical industry is bone on bone. You have bone on bone, right? Oh, nothing you can do, it's bone on bone, okay? So I would disagree with that. You truly do not have bone on bone if you are standing, let alone walking. Just because they cannot see the cartilage on their x-ray is why they use that phrase, bone on bone. But again, You would not be able to stand, let alone walk, if you actually had true bone-on-bone. So it's there, the cartilage is there, it might be very minimal, but the whole point is we can actually start healing and regenerating safely and nutritional wise. And that's what's very, very, very unique about our approach. So let's talk a little bit about inflammation here, just to give you a little background on it. It comes from the Latin word inflammare, which literally means to set on fire. The whole inflammatory process of cascade events in response to injury or trauma, and that can be either physical, chemical, or biological. And this can happen acutely or chronically as well. So acute pain or chronic pain. So it affects our tissues, our cells, our blood vessels are all inflamed. And then the inflammatory process leads to repair and healing. So pain necessarily isn't a bad thing. It's obviously difficult that you're going through, but you need to have that pain and that inflammation to begin the repair and healing process. And of course, all the classic signs, redness, swelling, of course, pain, heat, can be any of these or all of these. These are all the classic signs and symptoms of inflammation. Now, the major players in inflammation are in your white blood cells. These are known as cytokines, leukotrienes, and prostaglandins. And drug companies, when they're testing drugs, they test these specific markers. And guess what? With the supplements that we have here, we've looked at the same markers, and it's helped with all of these different inflammatory markers as well on the cellular level. Of course, without any side effects, which is really the big issue. So what happens, and this is a classic example, the mediators increase blood flow to the area, leakage of the fluid in the tissues, resulting in inflammation. So a classic example of this would be sprained ankle. You get the fluid, the tremendous pain, the tremendous swelling, right? And that's what's happening with your ankle. And then over time, that swelling goes down and so forth. Okay, other symptoms of inflammation. Again, you can have, besides what we already talked about, loss of flu-like symptoms can occur, fevers, chill, decreased appetite, fatigue can occur. And again, as we're talking about with arthritis, osteoarthritis can irritate the joint and wear down the cartilage. Now, there's other types of inflammation as well. And these are classified as autoimmune conditions, such as rheumatoid arthritis, colitis, Crohn's, irritable bowel. Okay, there's actually over 70 different types of autoimmune issues now associated. We definitely feel that with autoimmune issues, there's food allergies that trigger these. And so we would like to do a food elimination program, eliminating dairy, soy protein, gluten, the protein from wheat, are at the top of the list, okay, as well. But we can have a dramatic impact on these type of conditions as well. So inflammation is really the root of all chronic health condition. And so that's why this is such a big deal with all major problems going on. So if you want to see a doctor, conventional doctor, of course, rest, exercise, physical therapy, ice, heat, combinations of those. Then we get into the medications and surgery. So the first approach is the non-steroidals, aspirin, ibuprofen, Tylenol, okay, naproxen. Then if those don't work, then they put you on the corticosteroids, such as prednisone. Then if those don't work, then they bump it up to methotrexate. And methotrexate is actually technically a cancer drug. So most people do not know that they are actually giving people cancer drugs for pain. So these should only be short-term emergency type of situations. These are never intended to be long-term. Long-term, they have serious side effects. So we'll talk about those here in a second. So with non-steroidals, one of the biggest problems, of course, is GI bleeding. Also, ulcers, acid reflux. Does anybody know how long somebody should be on a non-steroidal? Less than a week? Okay. Any other guesses? Okay, 72 hours, 3 days, 3 days. It actually says it right on the insert, the non-steroidal. Do not take for more than 3 days. Okay, so that includes aspirin, by the way, as well. 72 hours. After 72 hours, 3 days, we've actually seen cases of ulcers start forming, okay? GI bleeding start forming as well. Then we get into other situations. Kidney problems can occur. Liver issues can occur. Heart issues can occur, okay? This is a big problem with these type of medications. So, I don't know if you guys remember a few years ago, this is about 10 years ago now, there's a couple famous basketball players who had to retire because both of them in the same, basically week, were having kidney problems because of all the use of the non-steroidals. Alonzo Mourning and Sean Elliott were their names. So this makes the headlines for a few days, and then it kind of just gets swept under the rug with the situations. But this is a major problem for athletes as well who are taking these type of pills. Then we get into the corticosteroids. As we mentioned, prednisone is at the top of the list. You can see the numerous side effects of prednisone at the top of the list. Weight gain, okay? So fluid retention, big time. Think Jerry Lewis, the Jerry Lewis telethon, of course, the actor. What happened to him in his older days? That's due all to use of corticosteroids, heavy amounts of corticosteroids. Then we get into other issues. It affects appetite, it can affect stomach acid secretion. It affects how we absorb minerals, so it can lead to osteoporosis. Osteoporosis, okay, has a huge problem with corticosteroids. Adrenal issues as well, diabetes can occur as well from heavy use of corticosteroids, and it's not on this list, but candida fungal issues. So I was at a seminar recently. The speaker said that 3 out of 4 women have candida right now, and 1 out of 2 men have candida right now. It's that big of a problem. And one of the reasons why, corticosteroids. So this is a study that most people have never seen, unless you've been here before. We've talked about this before. But this goes looking at non-steroidals. And this is the amount of deaths that occur due to the non-steroidals. And this was published in New England Journal of Medicine, which is the holy Bible of medical doctors. This is what they refer to when they are giving talks and lectures. They refer to this journal as well. So, 1997, they said this, the amount of people who are dying a year off their non-steroidals, off their aspirin, off their Tylenol, off their ibuprofen, was 16,500 deaths a year, okay? To put that in perspective, that's, by the way, that's just United States, and that's just prescription. They can't even track over-the-counter non-steroidals. But that's the same amount of people who die of AIDS worldwide, which everybody associates as an epidemic. Everybody knows about AIDS, right? But you never hear about this aspect, the dangerous problems associated with taking your ibuprofen, okay? So that was back in 1997. And we actually have this article. If you want to read this, we have this article in the back. We can supply that for you if you don't believe us. But this is even more recent information. This is January to March of 2008. This is the FDA's own adverse event reporting system. And this is public knowledge. Anybody can look this up. In this 3-month period of time, people who died from taking Tylenol in the United States was 1,500 people. Disabilities, another 1,400 disabilities. Aspirin, 716 deaths, another 678 disabilities. Ibuprofen, such as Motrin and Advil, 357 deaths, another 300 disabilities. And Celebrex, 119 deaths and 91 disabilities. Okay? Keep in mind, this is just what is reported So in a 3-month period of time. Now, I don't know about you, but I didn't see this in the news. I didn't hear about this on TV. I didn't hear about it on the radio. But this is happening all the time, folks. All the time. But again, the doctors just don't know any other options. Medical doctors only know 2 things: medications and surgeries. That is it. They've never taken a nutritional class in med school, and they've never taken a nutritional class since med school. They don't know any other ways, okay? How do I know they've never seen this? Because I've showed medical doctors this. This is what I do for a living. I show medical doctors these studies, and they tell me, Mike, I've never seen this before. Okay, great. So that's our starting point, okay? So this is why this is such a serious issue, and this is why we wanted to come up with something natural that's going to give you all the benefits of those medications without any of the side effects, such as death as a side effect, right? So X-Flame is our core formula, and we have this in capsules or powder that's going to really help with all the inflammation. It's going to help reducing pain and swelling. It's going to help increase mobility. And if you're on these medications, it's a way to really transition off the medications, or if you haven't started the medications, it's a great natural substitute. So this formula, X-Flame, I'm just going to pass this around for those who've never seen this. Okay, we have it in a capsule or we have it in a powder, and we'll go over dosage here in a moment. But this has 10 different ingredients in it. Some of these ingredients you probably, if you're into nutrition, you might have seen before, heard about, but some of these you might have never heard about, starting with the first one called cresellazine. Then we get into dimethylglycine, DMG, turmeric, boswellia, quercetin, root and ginger, luteolin, and cayenne. So every single one of these ingredients has research to reduce pain and inflammation, every single one of them. And you can buy every one of these individually and separately. And most health food stores carry most of these things here. But what our company tries to do is we try to combine multiple different ingredients together. This is called synergism, where you get faster, quicker results when you combine many things together. And that's our whole point. Besides, who would want to take 10 things when you can take one thing, right? I know I prefer one thing. So let's break this down. Start with the cresellazine. So you might have never heard of this before because it's a relatively newcomer to the nutritional industry. It actually is a combination of a fatty acid complex combined with a pH buffered form of creatine fused together. Okay? It has a US patent on it to reduce inflammation, increase flexibility, and modulate pain. So if you know anything about the patent process, number one, it's extremely expensive. Number two, you better have the research to back it up. So we can actually make a health claim for pain and inflammation with cresellazine. Okay, very, very rare in the nutritional world. And there's many studies on this. We'll show you one here in a moment, but this is goes back to 2009 in the studies. And here's one of those studies right here. So this was a double-blind, placebo-controlled trial. And in this group, they basically asked the people in the studies, how would you compare this to your current NSAID after 30 days? Okay, that's basically what this came down to. So for ankle and foot pain, 100% of the people in the study said cresellazine was just as good, if not better. For your other extremities, neck, shoulder, elbow, wrist, hand pain, 80% said just as good, if not better. And for knee pain, 71% said just as good, if not better. So if you average this out, it averages out to about 75% of the people in the study said just as good, if not better, than their non-steroidal, okay, with no side effects. So that's pretty remarkable study. And we see studies like this all the time, and some of these things seem a little bit too good to be true. One of the nice things about here, this clinic, is because there's so many people that come through this door, which is one of the largest clinics in the entire United States in the nutritional world, is that we can actually do our own independent pilot trials. And that's actually what we did with cresellazine on a much larger sample pool. We actually tested over 144 people and who were taking NSAIDs. We asked them the same questions, and we got exactly the same response. 75% of the people in our own independent trial saw the same results. And, whenever you see these kind of studies, you always have to be, well, did they avoid certain foods? Was there food restrictions? What else were they doing? What was their exercise? There's a lot of variables and factors. When we do our own trial here, this is real world, real life. People are doing whatever else they want to do. They leave the building. So this is real world when we're doing them here. So we know for sure that this ingredient absolutely works. So that's when we said we need to utilize this in this formula. But this is very, very unique. Okay? So that's the first ingredient. Here's some testimonials here in the studies. Person here with arthritis and swelling in knees worked better than any drug I've ever used. Here's another one, had shoulder pain, did what the over-the-counter pain medication could never do, increased my mobility, where I actually could live a normal life. And here's one with back and knee pain, worked so well, I did not notice the pain at all during the day. It took about 3 to 4 days, which is what most people, it takes about, depending on the severity of the pain that we're talking about, 3 to 4 days. Okay, some people do notice it right away in the first day. I've had cases where that has happened. But most people, it takes about 3 to 4 days for this to work. Second ingredient, DMG, dimethylglycine. I could do a whole talk just on this. I won't today. I am later on this week. But this has 3 different US patents on it. A patent on it for the treatment of arthritis and inflammation, which is why we're using it in this formula. Okay? Has a US patent to boost your immune in the treatment of all inflammatory disease. And it has a US patent on the treatment of melanoma, cancer. In fact, DMG is the only supplement in the United States that I'm aware of that we can make a health claim to treat cancer. Now, it's one piece of a very large puzzle. This would not be the only thing that we would recommend if you have cancer. But if you do, come see me or make an appointment here with Dr. Wine or any of the staff, and we'll go over all this with you in much more detail. But this is very, very unique, very unique. So the first 2 ingredients in this formula both have US patents to treat pain and inflammation. Again, we can make health claims. It's the only supplement that I've ever seen in 20 years that has 2 different patents on them. And that's what makes this different. Can't buy this at GNC, you can't buy this at your chain stores, and you definitely can't buy this at Walmart. Okay? That's the difference when people say, what's the difference between your stuff and stuff I can buy at the grocery store? This right here is the difference. Okay? This is very, very unique and extremely beneficial. Okay. So, we have it in the powder or the capsules. 30 servings for both. They're both the same cost. The dosage is, if you have an acute pain issue, pulled it back, hurt your shoulder, hurt your knee, whatever the case might be, we would do 3 servings a day, 3 times a day. If you're doing the powder, that would be 1 scoop 3 times a day. Okay, so breakfast, lunch, and dinner, 1 scoop. It has like an orange citrus flavor to it. If you are doing the capsules, 4 capsules equals 1 scoop. So it would be 4 capsules 3 times a day. So 4 breakfast, 4 lunch, 4 dinner, until you feel the pain relief, and then we back it down to 4 capsules. Back it down to 1 serving on both. Okay? But most of the people who do this formula love it if they take it that way. When people come back and say, I tried it, it didn't work, I say, how many did you take? Oh, I took 2 capsules. Yeah, you want to take 12 capsules, not 2 capsules initially. Once we do that loading dose, once it gets into your system, once you start feeling better, then we back it down. But we have to start aggressive initially. So that's really, really important on that. Okay. The only caution with DX Flame, and it's not life or death, but it's Coumadin or warfarin, the blood thinner, Coumadin or warfarin. If you're on Coumadin or warfarin, this does again has a fatty acid component to it. So we do have another option with that, the Inflame. So people always ask us, what's the difference? The difference that this doesn't have the creselazine, and it doesn't have the DMG, doesn't have those 2 patent ingredients. So it's a little bit different in variation, but you can take this if you're on Coumadin or warfarin. Yes? Yeah. You love the Inflame. You're doing the Inflame. So the Inflame, you don't have to take as much, so I'm just going to pass that around. If you're in pain, acute pain, we would bump that to 6 a day. 6 a day on that one, and then 2 a day once there's pain relief. But yes, so we get great response. It's always good to hear that situation there. Okay. Any questions on this formula, the X-Flame, before we move on? Yes?
You were talking about taking NSAIDs. I only take it usually just a bit
Once a day?
Yes.
Which ones do you take?
Advil.
Advil?
Yeah.
Okay.
Is that, how bad is that?
It's bad. Again, 3 days maximum is the amount of length of time that you're going to take.
Take it once a day?
Yes, once a day. It's going to, the length of time that you're using is bad for you. By the way, the FDA, I should have mentioned this earlier, the FDA just changed their policy on aspirin. That is not recommended as a first choice for pain. They just changed that about a month ago because, again, the long-term damaging effects. And we have studies in the back that actually show people over 75, aspirin can actually increase your risk of certain strokes. Increase. So aspirin is bad for you. Advil is bad for you long term. So if you're going to take those, again, 3 days at a time, give your body a break, few days, and then 3 days at a time. You don't want to be on it long term, okay? Even if it's just 1 a day, that's bad for you. So that's why we're talking about these natural things. They're much better, much safer because, again, these medications, they block other mechanisms in your body. And so it's not repairing or healing, it's just Band-Aids.
When we're talking about the X-Flame, is this for any kind of pain?
This is for any type of pain or inflammation. Yes.
What's the FDA say about these?
The FDA say about these as far...
Flame, and is there any studies on those?
Yeah, there's hundreds of studies on the individual ingredients. But the FDA, again, so the FDA, our supplements are made in an FDA manufactured facility. So there's certain things we can say about them, there's certain things that we can't. But those two things that I mentioned, the creselazine and the DMG, we can make health claims on them, okay? So yes, it's a gray area there with the FDA, but our manufacturing facility are made in an FDA facility. So it's the highest level you can have on the ingredients as well. Yeah, okay, does that make sense? Any other questions about the X-Flame before I move on? Make sense? Okay. HA+. So this is more for chronic pain. Chronic pain. This is our #1 seller of all the supplements that we have in the back. And we have over 5,600 last time I checked, 1,600. This is our #1 seller right here, HA+. It's been proven to work time and time and time again for chronic osteoarthritic joint pain. This is what replenishes that synovial fluid, and over time, this will really help to regenerate tendons, ligaments, and joint tissue, okay? So this is huge. So we see the breakdown, we'll break all those down. Hydrolyzed collagen type 2, glucosamine, MSM are the main ingredients in the HA+. I'm just gonna pass that around for you if you have never seen that before. We have this in 3 sizes, a 60, 120, or 240. But the main ingredient and what makes this truly unique is called BioCell Collagen. BioCell Collagen. So this is a matrix that includes collagen, chondroitin sulfate, and hyaluronic acid. Okay, and it's been proven to be absorbed in the GI tract. It's actually made from chicken cartilage. No adverse reactions, no interactions whatsoever on this, and it's grass-fed meaning generally recognized as safe by the FDA. That's what that terminology means. The studies on this for joints promotes joint comfort and mobility, okay? Helps renew cartilage and promote joint cushioning and lubrication. That's the synovial fluid I was talking about. It strengthens the cartilage and joint structure, and also it does have some anti-inflammatory properties to this as well. For skin, supports healthy skin structure. It actually increases hydration, hyaluronic acid, and may help reduce the effects of aging, such as wrinkles and fine lines. So, also may be helpful for hair and nails. Yes?
Everybody said that it's helpful for stiffness in the morning.
Yes. Yes, it is great for stiffness in the morning. Yes, it is. Absolutely. Yeah. Yes, it will. That's a more serious issue. For those type of issues, we would recommend that with the X-Flame or Inflame as well. We would also recommend to see one of the chiropractors here or Adam, the massage therapist, because that's a more structural situation going on, more inflamed, more alignment issues going on. So this will help, but we would really recommend they come in and make an appointment, and that we can really help them a lot better with that. Yeah.
Take both of these at the same time?
Yes, you can take both these at the same time, especially if you have these joint issues. So we use the analogy of a house that's on fire, right? You can't rebuild the house if the house is still on fire. In this case, that pain and inflammation is the fire. So the X-Flame puts out that pain and fire, that inflammation, and then the HA Plus rebuilds the house. So these work together faster, quicker. Can you just do one or the other? Yeah, absolutely, you can. It's just going to take a little bit, it's going to take longer for you to see the effects. And most people want the fastest, quickest results when it comes to pain aspects of it. But with the skin studies, by the way, which we like to call positive side effects, by the way, positive side effects, this is the only hyaluronic acid that has been shown that you can swallow orally that's been shown to reduce fine lines and wrinkles on the market. So a lot of companies claim it. This is the only one that actually has the published studies to back it up. So that's another nice benefit of taking the HA Plus. Not only good for your joints, but excellent for your skin as well. So here's some other things too, right? So there's other forms of glucosamine on the market. A lot of the stuff that you buy at the chain stores is glucosamine hydrochloric acid. Okay, this is cheaper. The reason why it's cheaper, it's not as effective. If you break it down as far as all the benefits, absorption, intestinal transport, clinicals, all the different things, you see, no, with all these other forms of glucosamine. The one that you should always buy and look at is glucosamine sulfate. And the research shows you need to be at 1,500 milligrams a day before you get the maximum benefit of glucosamine sulfate. Yes?
Is that NAG or NAC?
That's NAG. NAG, yes. Now, a lot of glucosamine has been around for a long time, since like the 1980s. Glucosamine has been around. The research shows about 50% of the population, if you're taking the right form, the right amount, and you give it about 2 months, about 50% of people really feel and notice the difference. So that's great if you're on that side of the coin, that 50%. But what if you're on the other side, the other 50%, that you are taking it and not seeing any results whatsoever? And that's why this formula is unique, because that hyaluronic acid is really a precursor to glucosamine, and you're going to get the maximum absorption. This works about 95% of the population that this works on. Yeah.
I guess I wasn't listening very good. What's this for?
The Inflame?
Yes.
The Inflame is an option, different option if you're on Coumadin or warfarin versus the X-Flame. Yep. Okay. So here's another study on the BioCell collagen 2. So again, we looked at all the different studies and research that it does. You can see the collagen type 2, the BioCell has all the research, and then there's other forms that are out there that people claim that it's the BioCell. It's not. So we're just trying to break it down, absorption, molecular weight, everything. You go on and on and on and on. But the bottom line, we're trying to point out that this has the most research of any collagen that is out there on the market, and that's why we're using it. So, hyaluronic acid, as I mentioned, okay, lubricant, improves that synovial fluid between the cartilage and the joints and the bones, acts as a cushion for the bones, and it also it acts as a detoxification role as well. Not many people know that. It removes waste from the joint capsules that build up over time as well. So another benefit of hyaluronic acid. And so up until 2004, there had never been any studies that say that you could actually take hyaluronic acid orally. In 2004, a group of doctors got together and showed that this form, this patented form of BioCell, was a double-blind clinical study showed that this was much better than any other form of hyaluronic acid on the market. Okay, so that again, that's why we're using it. That's why Dr. Weiner recommends it, and that's why it's our #1 seller, because time and time again it's been proven to be the best. And here's some just highlights from the study. It actually got peaked in 36 hours. Actually significantly increased in 4 hours, meaning got into the bloodstream. It was absorbable, okay? And the unique thing about this is it actually shrinks, this patented technology shrinks the molecular size of the hyaluronic acid 600 times smaller. So therefore it's much more absorbable. And again, that's why some people have difficulty absorbing glucosamine, because that molecule is very large. So this patent technology shrinks it 600 times smaller. And again, that's the uniqueness with the BioCell. In 28 days, it actually showed a steady state. So it takes about 20 days to be consistently in your system. After 7 days, it became stable. Okay, so again, these are all very important studies to show stability and getting into the system. Okay, so found in all tissues and fluids of the body. Helps again with lubrication. So you get the drift of it on and on. Numerous safety studies with this as well. Safety is always a concern on this. So again, that is where this would be. It shows you again as far as absorption. So there's all different studies. You get the drift, not going to get too technical here. Again, this is what doctors are interested in seeing. This is what they want to see. So that's where I just wanted to show you that there's numerous studies as far as absorption goes. And again, peaking within 12 hours. So it gets into your system very, very quickly with the hyaluronic acid. So these are some newer slides. So even people that have seen some of these slides before, these are some newer up-to-date information on the BioCell that we wanted to present today for this. So you get the drift of this on that. Here's another interesting study with the BioCell. They looked at all these different factors. These are basically symptom questionnaires on pain, stiffness, total score, quality of life, quality of sleep, all showed significant improvement using this form of hyaluronic acid, where placebo didn't show anything. There was no difference. So it's going to help with pain, with stiffness, as you mentioned earlier, asked about, quality of your life, and the quality of your sleep will improve on the studies. Here it is shown with wrinkles. So again, it actually shows how it takes about 14 to 21 days to get into your system to really help with wrinkles and fine lines. So again, it's not overnight. It takes some time, but it really will help on that. Okay, we do have it, just before I get into the fatty acids real quick, we do have this also in a vegetarian powder. I forgot to bring it, okay? So this, the glucosamine in the HA Plus is from shrimp, shellfish, okay? But it's not the shellfish protein that people are allergic to or sensitive to, okay? So we do want to emphasize that. So we have had people who are extremely allergic to shellfish who are still able to take our HA Plus without any problems whatsoever. But we do have a vegetarian powder option if you are strictly a vegetarian, or if you, are just really sensitive to shellfish and you don't want to take any chances, even though we're telling you right now it's not the shellfish protein and that's what you're allergic to or sensitive to. So we do have that option. If you are in pain with the HA plus, it's 4 capsules a day. 4 capsules a day. Once you feel pain relief, then you drop it down to 2 a day. 2 a day. Can you take this forever? Yes, you can. You can take this forever if you want to. That's your choice. But as you age, you lose that layer of fluidity. That synovial fluid becomes less and less, and that rubbing against your bones and your joints starts happening more and more. So again, this is something that we do recommend at least 1 a day, at least as far as a maintenance dose on that. Yes?
If you took 4 a day, would it be 2 and 2?
Would be 2 and 2. Whenever we get doses like that, we recommend dividing it 2 and 2.
If you were on 2 a day,
1 and 1.
1 and 1, 1
Yeah, we recommend it. You break it, always break it in half. If you forget, you can always double up for that 1 day. Not a big deal, but you try to do it consistently. So breakfast and dinner, I always try to take my supplements, breakfast and dinner, on these type of things to get the maximum benefit, okay, on that. Okay, before I move on, we do have another formula called green lipid muscle. Green lipid muscle is exactly what it says it is. It's mussels from New Zealand, okay, a fish. So this is very interesting. This would be better, more specific for tendons and ligaments over the HA+. HA plus beneficial for that too? Yes, it is. But I've actually had better clinical results with the green lipid muscle, especially for shoulders, especially torn rotator cuffs, okay? Again, that's very difficult to heal, the mobility in your shoulder joint. So the green lipid muscle actually works a little bit better for those type of injuries versus the HA plus. So if anybody has anything like that, shoulder injuries especially, that's where we'd recommend the green lipid muscle. 6 a day to start with, then back it down to 2 a day once there's pain relief. So that's where the green lipid muscle fits in. Yeah?
You have a stretch ligament, and the doctor says that's the only way you would carry a surgery. Is that tight?
Sorry, say that again?
You have a stretched ligament, and the doctor said the only way it's going to be carried is like surgery.
Uh-huh.
Will that tighten it?
Will that tighten it? It'll strengthen it. Yeah, it'll strengthen it. But again, your doctor's perspective is that he's never been seen these studies, he's never seen the research on that. So his perspective is different than our perspective. So I would still get checked out here, have them look at it, have our massage therapist look at it. And again, that's why I use that analogy. We've had people with torn meniscus that HA plus is healed within 3 months. Healed within 3 months. We've had people who said they needed hip replacements that within 6 months, taking HA plus, canceled their hip surgery. We've had all kinds of numerous injuries that doctors have told them nothing will help, there's nothing you can do. They took the HA plus consistently and it healed their injuries. We've seen that time and time and time again. So it,
Green lipid muscle or something like say ligament plus. What make that ligament tight? Shorten up and can it possibly do that?
yeah, you have to work with the physical, like massage therapist, or muscle therapist, Adam, chiropractors, people who are specialized in that type of therapy, muscle therapy. Adam's really good here, but yes, they will work with you and give you specific exercises that will tighten and strengthen that tendon and ligament. Yes. Question? Good? Okay. All right. Any other questions about this? Yes.
My problem, not from an injury as far as I know, but I've had problems with my
Calf?
for 49 years.
Okay.
And I think it's the ligaments or the tendons or something.
Yeah.
I mean, therapy right now for it. Which would you think I should try?
For your calf, well, the first thing I would recommend you come in. Have you seen Adam here?
Yes, I'm coming.
And has that helped at all? Somewhat?
I don't know. I wouldn't say what they're doing.
Yeah, so again, if you're having acute pain, I really don't want you doing that Advil. I'd rather you do the X-Flame or the Inflame for that acute pain, and then the HA Plus to really start helping with it as well. There also could be a tightness in the muscle itself, okay? So if that's the case, then our Frontier Minerals I would recommend. So for example, plantar fasciitis, which most people feel in the foot, okay? And most doctors will tell you it's a foot problem. It's not. It's actually a tightness, and it's a mineral deficiency and a tightness in your calves, which are actually causing that foot pain. So just by doing 2 minerals in the morning, 2 in the evening, and working with Adam just a couple times, and he'll give you some exercises, calf exercises, usually within 2 to 3 treatments, you do not have plantar fasciitis anymore. Okay, so we've had all different types of issues. The smaller the system, right, the faster you're going to result. So fingers, wrists, feet, toes, things of this sort, HA plus usually feel within 2 weeks of taking it, okay, in most cases. Larger the body movement, shoulders, hips, knees, the more severe it is, the longer it takes for you. Most people do see a difference in 30 days if you're consistent with it, okay?
This muscle stuff, do you take it with the HA plus?
Yeah.
Okay.
Yeah, you can do both or one or the other. I'm just showing you how we differentiate, how we position both. Okay. Then the last thing is fish oil, omega-3s. Omega-3Ds is the name of our fish oil. We have this in both soft gels or liquid, depending on what you want to do. This is one of the strongest fish oils on the market. Helps with thousands of different benefits, but one of the benefits is reducing pain and inflammation, okay? So it's really, really, really important as well with this. So we know there's a lot of fish oil out there on the market. Pretty much every supplement company has one. So we just wanted to show again what we do differently that maybe some other ones do not do. I can't speak for any other ones. All I can speak is what we have. But again, these are produced in what's called CGMP, Certified Good Manufacturing Practices. This is regulated by the FDA, FDA audited facility, okay? So when a medical doctor says to you supplements are not regulated by the FDA, okay, that's not true. The manufacturing facility is regulated by the FDA. It took the FDA 13 years to develop this, but all of our supplements are produced in an FDA audited facility. And then there's other certifications that we go through as well. We guarantee purity and potency on all of our supplements until the end of the expiration date, not just fish oil, but all of them. And then we go through all different types of purity testing, physical analysis, independent testing as well to make sure you get what it says it is in the bottle. And we actually have listed some of these studies on our website as well. But fish oil is broken down into 2 parts, EPA and DHA. That's what you should always look for in a bottle with fish oil, okay? EPA, just simply put, is more for pain inflammation, okay? DHA is more for brain and heart benefit. But the bottom line is we want at least, if you're in pain, you want 2,000 milligrams combined of EPA DHA or 2 grams. So 2,000 milligrams equals 2 grams. So for our fish oil, that will be 3 a day. 3 a day gets us over that 2,000 milligram mark. Actually puts us a little over, like 2,100. We guarantee 780 per pill, okay? Most fish oil on the market use very little EPA DHA, and so you have to take a lot of it to equal that 2 gram mark. So most people, most companies, the price might be less, but keep in mind you have to take 9 of them to equal 3 of ours to get the same benefit. So that's what people don't realize when it comes to fish oil. So that's what we would recommend. That would be the third piece of the puzzle for pain, all pain and inflammation to get you the fastest, quickest benefit. Now, we do have krill oil as well. So krill oil has been in the news a lot recently. Krill oil works the same way as fish oil. It's actually omega-3, 6s, and 9s, but it's the good 6s, the good 9s, okay? The interesting thing about krill oil is it actually goes through a micellation process in the gut. It's absorbed much better than regular fish oil is, so you don't need as much of the EPA, DHA, and krill oil that you do regular fish oil. So the point with this is that you, for pain, inflammation, just need to take 2 of the krill oil, 2 of the krill oil versus 3 of the regular omega-3D. Also, in head-to-head studies versus fish oil, krill oil has been shown to be better as far as lowering cholesterol, the bad cholesterol. In fact, 10 times better in 3-month studies. Raising the good cholesterol, 10 times better. And lowering triglycerides. So if that's an issue of your concern for you, krill oil would be the better choice. Okay. Also, C-reactive protein, which is an inflammatory marker that a blood test that medical doctors can test for now. Krill oil has been shown to be better than regular fish oil for that. And PMS hormonal issues, all hormonal symptoms, krill oil is better than regular fish oil. Again, all those we would do 2 a day. 2 a day of the krill oil. Okay? But we do not want to do both. We do not want to take krill and fish oil together because they both compete against each other and they both counteract against each other. So it's one or the other. You do not want to do both at the same time. So those are just some different options. And we also have an herbal tincture. Okay, so say you do not want to do pills, you don't want to do powder, or you strictly want to do herbals. We do have that option for you. Again, called inflammation herbal tincture. If you're in pain, we do 2 droppers full in the morning with a glass of water or green tea or iced tea, and the same thing in the evening until you feel the pain relief. So that would be another option for pain inflammation if you don't want to do any of these other options.
You said you shouldn't take fish oil and krill oil.
Right, don't want to do both together. We want to do one or the other, not both at the same time.
You take them at different times on the same day.
No, not at all. So we're doing one until we finish the bottle, and then we're doing the other until we finish the bottle. We're not doing
So
both.
You can't do fish oil one day and krill the next day.
No. No. Do not want to do both. Okay? Yes, sir.
How does the green mussel help with the rotator cuff?
Well, it really seems that with tendons and ligaments, really helps strengthen tendons and ligaments much better. And of course, with your shoulder, there's 3 different structural issues going on there. So that's why it's such a difficult area to heal really quickly. So it really just tends to just strengthen the tendons and ligaments from what I've seen better than what the other options are that we have.
Take it with the X-Flame and you take it with.
You can do all 3, yes, absolutely. Now, the other most important thing is the diet. So if we open this book up, the Joint Solutions brochure, the other most important thing is the food, okay? As I mentioned, there's certain foods that are triggers for inflammation, especially dairy, especially soy protein, especially gluten, okay? So this is our anti-inflammatory diet. It's nothing crazy or exotic. This is a modified Mediterranean style diet. So lean proteins, chicken, turkey, fish. Know your sources, wild as much as possible, or organic. If you go to a restaurant and you ask for wild fish and the waitress says, "What's that?" then you don't order it. Okay? So that gives you an indication of the quality of that restaurant. Okay? Fresh fruits and veggies, of course. Know your sources, organic, good nuts and seeds. Okay? And good fats. And I would put out, it's not on here, but I would add grapeseed oil as well to good fats. Grapeseed oil, extra virgin olive oil, coconut oil, these are all your good fats. These are going to reduce pain and inflammation. Yes? Avocado oil is fine. Yeah, that's good. That's good. But of all the oils I've seen, grapeseed oil actually tests the strongest for reducing pain and inflammation. Okay? Yes?
It says avoid oranges.
Well, we say oranges because that's the acidity. There's acidity connection there with oranges and grapefruits. So there's a connection there. So we would, again, if oranges are the worst thing you're eating, then I wouldn't really worry about it. Same thing with tomatoes. Bananas, we would avoid it in limited amounts because bananas are very high in sugar. So we would have really, if you're going to have a banana, do half a banana. Do you ever hear the saying, if you eat too many bananas, you go bananas? Yeah, okay. Yeah, it spikes up blood sugar. So if you have blood sugar, which there is a connection between high blood sugar and inflammation as well, we would limit that. We stick with the berry family. Berries, strawberries, blueberries, raspberries, blackberries. You know, those are the fruits that we would recommend the most of. But the more consistent you are with these foods, the faster, quicker results you're going to get with the supplements. Okay? Now, are you going to have days where you're at a birthday or wedding or whatnot, and you're limited on what you can eat? Sure. Yeah, absolutely. I understand that. But you just want to be consistently trying to eat these quality foods, because these foods will really reduce your inflammation. Okay? So bring this to the grocery store with you. Hang this up on the fridge with you. Get familiar with these foods. The more you eat consistently of these foods, the better your pain will be, the better you will feel, the better your digestive system, the better your bowel movements, the more energy you will have, and so forth and so on, by eating these foods consistently. Okay? Now, of course, if there's something here you don't like, don't eat it. But we try to give you a lot of different options on what you can eat. Okay? So try to stay away from the bad fats, the processed sugars, and all the fast foods and all that. Yeah.
You were saying earlier on, with the breads, we consider a certain kind of bread.
Yeah, Ezekiel bread is the bread of choice. If you're not familiar with Ezekiel bread, it's found in your frozen food section at most grocery stores. It's from organic sprouts, but it has a taste and texture of bread. Okay? Ezekiel. Yeah, just eyes. Yeah, no, easy, just like the Bible. Yeah, it comes from the Bible, right? And unfortunately, it's usually next to the ice cream section. So just say no to the ice cream. Just look away. Just say no, and just go right to that if you're going to have it. But again, we want to do it limited amounts. We don't want to go like eat a loaf of bread a day of Ezekiel bread either, right? 1 or 2 slices at the most. If we're trying to lose weight, by the way, we remove all bread completely to get faster results losing body fat. Yeah.
I recently found some Ezekiel cereal.
Yeah, there's Ezekiel cereal, there's Ezekiel wraps now, there's all kinds of that, yes. All those are better options, but again, what are you mixing the cereal with? Okay, there we go. Almond milk, coconut milk, rice milk, right? Stay away from the dairy, all right? So here's the most important thing, is the food. Can't emphasize that the most. Any other questions? Yes?
Nutritional yeast, is that healthy? I was heard it's full of B
Nutritional
vitamins.
yeast, like brewer's yeast?
I just was told nutritional yeast, sprinkle on food is supposed to have a lot of B vitamins.
Yeah, there's brewer's yeast we have back here, if that's what you're talking about.
I bought it at Whole Foods. I didn't know if it was true or not.
Yeah, if it's brewer's yeast, yes, it is good. Yeah. Chia is another type of seed, right? It's actually chia plant is where that comes in from, is my understanding. Again, it would be just like another form that's good for you. There's a lot of good properties to it, so it's another healthy option. Yeah. What's that? I haven't heard that. So, again, if you're sensitive to certain seeds, then you obviously want to stay away. Okay, folks, my time is up. I will be in the back to help answer any more questions. I have some extra copies if you have friends or family or neighbors who weren't able to attend. Help yourself. Hopefully now you have a little better understanding where we're coming from with these ingredients, and hopefully now you're seeing some studies how dangerous Advil 1 a day can be. 1 a day could actually kill you. Okay? So, thanks so much. Appreciate your time. Have a good time.